It is Wednesday, so that means it's time to answer some common medical questions. And joining us is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you for being in our newsroom with us today.
You're welcome. Good to see you, Keely.
Well, here's the first question for you. This happens a lot in South Florida. Folks get stung by jellyfish. So what's the best way to stop that pain?
Yeah, it sure does happen a lot. Matter of fact, if you're a Floridian or like to frolic in the ocean at all, it's something that you absolutely should know how to treat. And I want you to remember a couple things. One is rinse, scrape, and soak. And what I want you to do when you rinse is I'm not talking about fresh water. Matter of fact, fresh water will make it worse. You want to use vinegar or isopropyl alcohol, and you want to soak it for about 20 to 30 minutes, and that'll help deactivate the nematocysts. Once that occurs, then you take a straight edge like a credit card, and you scrape the area and get all those stingers off. Once that's done, you need to soak it in hot water. Not scalding water, but warm enough to really feel the heat, and do that for, again, about 20 to 30 minutes, and it'll feel much, much better. Another thing that actually works is ammonia. About 4-to-1 water with ammonia works real well, decrease the itching and the pain. Now, a couple things I want you to keep in mind. First of all, do not rub the area. The first thing you want to do is when you get stung is you want to reach up and rub it. It'll make things a lot worse. Don't do that. And despite a lot of people's belief, urine on the sting does not work. Do not use that, okay? Remember those things, and you'll do much better in the ocean.
Okay, we talked about this kind of last week. We talked about the food poisoning. Lots of folks go to barbecues seemingly every weekend. Well, now we're going to talk about food poisoning. We want to know what kinds of food cause heartburn, because we have to know this before we head out to those barbecues this summer.
You bet, you bet. And a lot of times over the summer we tend to alter what we eat, and those foods can definitely contribute to that. Two things cause heartburn. One is increased acidity in the stomach, and the second is foods that can actually decrease the tightening of the sphincter that holds food in the stomach. So the types of foods, if you have heartburn, I want you to avoid are as follows. Avoid greasy foods, fatty type foods, butter, margarine, salad dressings, mayonnaise.
The good stuff.
You bet, unfortunately. I want you to avoid chocolate, even better stuff. Avoid things like spicy foods, citrus-based foods like tomatoes or even orange juices. And then avoid certain beverages, caffeinated beverages, alcohol, and carbonated beverages. All of those can contribute to heartburn. But it's not only what you eat, it's also when and how much. If you eat before you go to bed or before you lie down, that gravity can pull that acid up into the esophagus and cause heartburn. And it's also how much you eat. If you fill your stomach, pressure up into the esophagus, burning sensation. Try to avoid those things, and you'll do a lot better at those barbecues this summer.
So let me get this. We can have a salad or a tofu burger at the barbecue.
That's exactly right. Just don't put any dressing on it, Keely.
Right.
Just the lettuce.
Just the lettuce. All right. We'll just have cucumbers. Thanks a lot, Dr. Soria. We appreciate you coming in.
Very welcome.
And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, then clicking on the health link, scroll down on the right-hand side, and that's where you'll see the form to write in your question. You have just ruined all of our barbecue outings for the week, but we love you anyway.
I apologize, but at least you'll be healthy.
Thanks.